Congenital dislocation of the hip is a disorder of the hip joint. It is usually diagnosed in infancy. When you see your neonatologist or pediatrician spreading your child's legs apart and putting them back together, they are clinically feeling for a click or clunk as the hip moves in and out of a socket. That is the most initial line of defense against hip dysplasia. It's yet another poorly understood inheritance pattern, so to speak, but there are certain things that leave you at risk for it. Firstborn breach, a family history, you are certainly more at risk if you have a family history of it. If we have truly diagnosed hip dysplasia on any level, whether it's a shallow acetabulum or a dislocating subluxable ball or a ball that's completely out, 0 to 6 months of age, we're treated in a Pavlik harness, which holds the child's legs in flexion and abduction. They look like a tiny little frog. And that's to be worn 22 out of 24 hours a day. It's put on in a way that diaper changing can be done with it. It's usually just taken off for bathing. Once you're in a Pavlik harness, ultrasounds are followed every 2 weeks until the acetabular dysplasia resolves, or the dislocatability resolves, or the problem is fixed. If the child's diagnosed older than 6 months or fails Pavlik harness treatment for some reason, generally we go to the operating room for what's called a closed reduction. If they're diagnosed greater than a year, and sometimes they'll be missed, and the first thing you notice is when your child starts walking, they almost look like they're waddling. They've got this little double waddle. And if both hips are dislocated symmetrically, those clinical exam findings are less reliable. You may not feel a click or clunk because it's not moving in and out. You may have symmetric knee heights because they're both dislocated. You may have symmetric thigh folds because they're both dislocated. You may have symmetric abduction. So when we see that child come in at age 1 or 2, that's requiring an open surgical procedure, usually approached anteriorly, where you're actually taking the structures that are blocking the reduction at that point, removing them and putting the hip into the socket, closing the capsule back down over it. So stiffness, early arthritis, dysplasia as an adult, something that's not quite right will lead you to a risk of arthritis as a younger adult. We already have many people living into their 80s and 90s. We have lots of hip replacements done on people who never had a hip problem. Not taking care of it early can lead you down that road where you may have issues as a younger adult than necessary. Conservative treatment, while a pain for many parents to comply with, can hopefully avoid that. Most kids treated with a Pavlik harness before the first 6 months of life will have successful treatment.